live in a world shared with trillions of organisms we cannot see. Most are harmless, but a select few have the power to shut down cities and change history. These are the drivers of communicable diseases. Simply put, a communicable disease is an illness caused by a specific infectious agent that spreads from one host to another. But let's look at the gold standards. The WHO, World Health Organization, defines them as infectious diseases caused by pathogenic microorganisms such as bacteria, viruses, parasites, or fungi. The diseases can be spread directly or indirectly from one person to another. The CDC, Centers for Disease Control, emphasizes the chain of infection, focusing on how these illnesses move through populations via environmental or biological pathways. Global and African prevalence. The burden of these diseases isn't shared equally. Globally, we've made progress, but the numbers are still staggering. Global context. According to the WHO, communicable diseases, along with maternal and nutritional conditions, still account for nearly 20% of deaths globally. While wealthy nations battle lifestyle diseases like diabetes, lower-income regions face a double burden. The African context. Africa bears a disproportionate share. The big three, HIV/AIDS, tuberculosis, TB, and malaria, remain the primary focus. The African region accounts for roughly 95% of global malaria cases and 96% of malaria deaths. Emerging threats. We are also seeing a rise in zoonotic diseases, animal to human, like Ebola and Marburg, often driven by rapid urbanization and climate change. The causes, pathogens, bacteria, cholera, TB. They are living cells that can multiply on their own. Viruses, influenza, HIV. They are genetic hijackers. They need your cells to reproduce. Parasites, malaria, worms, organisms that live off a host. Fungi, meningitis. The effects, individual, damage to organs, long-term disability, and immune suppression. Socioeconomic. This is where it hits hardest. Communicable diseases trap families in poverty due to medical costs and lost man-hours. On a national level, an outbreak can shrink a country's GDP by billions. The chain of transmission. To stop a disease, you have to break the chain. Here is how it moves. Infectious agent, the germ, the virus. Reservoir, where it hides, human, animal, or water. Portal of exit, how it leaves, sneeze, feces, blood. Mode of transmission, direct, physical contact or droplets, kissing, shaking hands. Indirect, airborne, lingering in the air, vector-borne, mosquitoes or ticks, or vehicle-borne, contaminated food or water. Portal of entry, how it gets into you, inhalation, ingestion, or skin breaks. Susceptible host, someone with low immunity or no vaccination. Signs and symptoms. Symptoms are actually your immune system's battle cries. They vary, but common indicators include systemic, fever, the body raising the heat to kill germs, and fatigue. Respiratory, coughing, sore throat, or shortness of breath. Gastrointestinal, diarrhea and vomiting. Common and waterborne diseases like cholera. Asymptomatic carriers, the most dangerous stage. This is when a person feels fine but is actively spreading the pathogen. Treatment strategy. Treatment is never one size fits all. It depends entirely on the pathogen. Bacteria, treated with antibiotics. Warning, overuse leads to antibiotic resistance. Viruses, antibiotics do not work here. We use antivirals like ART for HIV, or let the body's immune system do the work. Fungi or parasites, specialized antifungals or antiprotozoals. Supportive care. Hydration and oxygen therapy are often the difference between life and death. Prevention and control, the standards. Prevention is cheaper and more effective than any cure. Here are the global standards. Immunization, the most successful public health intervention in history. Vaccines train your immune system. Environmental control, clean water, WASH initiatives, and proper sewage disposal. Factor control, using insecticide-treated nets, ITNs, and indoor spraying to stop mosquitoes. Standard precautions, hand hygiene, the simplest, most effective way to break the chain. PPE, using masks or gloves in high-risk settings. Surveillance, governments tracking outbreaks in real time to quarantine the spread. Communicable diseases are a global challenge, but with the chain of infection in mind, we have the tools to break them. Stay informed, stay vaccinated, and keep the chain broken. If you have any comment and suggestion, drop it in comment section.